Secretary Becerra, it's so wonderful to see you since your first elected office was representing me in the California legislature nearly 40 years ago. So to see you in this position is just wonderful.
Thank you.
I wanted to talk about the administration's commitment to reproductive health, including the Title IX Family Planning Program. And I'd like to bring up the issue of contraceptive access, which is more urgent than ever considering the ongoing attacks on reproductive rights around this country. As you just said, the ACA requires health insurance plans to cover preventative services, including birth control, at no cost to the patient. But for years, there have been extensive reports of plans failing to comply by illegally denying coverage, delaying claims, requiring cost sharing, forcing step therapy, or failing to maintain a transparent exceptions process. Now, I appreciate that HHS recently released new guidance for insurers recommending they cover all forms of contraception, including a therapeutic equivalent, otherwise known as generics. But many of us members are very concerned about compliance with this, and that's why 143 House members and 13 senators signed a letter to the health insurance plans asking whether they're going to comply with this therapeutic equivalent standard. So my question is, how will the department enforce this new guidance to ensure that everyone has access to the birth control that works best for them?
Congresswoman, thank you for the question and actually for your just intense dedication to trying to address this. We have met with the plans and the plans representatives. We have met with pharmacies and the pharmacy representatives to make it clear that under the law, they must make contraception medications and services available at no out-of-pocket cost. We've also told them that we have enforcement authority under Section 1557 of the Affordable Care Act, and we are prepared to use that. We also we've explained to some of these entities that because they rely on services and reimbursement for services based on Medicare and Medicaid, that they must abide by federal laws in order to continue to receive those dollars. So we're going to use every lever we can to make it clear that there are laws in place that protect patients' access to care, and we will do everything we can to enforce those requirements and protections.
Thank you. That is so reassuring to hear. And then on a different topic, I'd like to bring up the role of artificial intelligence in Medicare Advantage coverage determinations. I'm concerned that the increasing use of AI in coverage decisions has resulted in wrongful denials of medical care for an alarming number of seniors enrolled in Medicare Advantage plans. In fact, there's a class action lawsuit going on right now against one major insurer's use of AI to deny medical claims where AI systems allegedly played a role in the denial of over 300,000 payment requests within a 2-month period. The average time spent supposedly reviewing each of these claims was a mere 1.2 seconds. So in response to these care denials, I sent a letter to CMS last November with 30 other House Democrats expressing the need to increase oversight of the use of AI in Medicare Advantage payment denials. I appreciate that the administration recently issued guidance that aims to increase oversight of AI tools. Can you talk about how the department plans to enforce the requirements that MA plans comply with Medicare rules and do not inappropriately create barriers to care?
Congressman, thank you for the question. And as you know, we are moving to try to remove some of the layers of obscurity that have made it very difficult for us to have clear sight on how the MA plans are operating and to have the data that shows how they're administering some of their programs. And so we're trying to make sure that we monitor the way the MA organizations use their utilization of utilization management tools that will ensure us that they are complying with the new requirements that we put in place in regulations. We're going to continue to make sure that if prior authorization is used for making decisions on payment of bills, that we have better sight and we understand what data they relied on. And certainly because of the preoccupation with AI, we want to make sure that algorithms aren't being used that discriminate against communities and populations because they don't take into account the full breadth and scope of circumstances and the data that's necessary to make sure that decisions are being made based on coverage.
And that is exactly what our worry is. Thank you, and I yield back.
Thank you.